So now we're going to look at priority health issues in Jackson County. And one of those areas that we're going to focus on is substance abuse, looking at youth. So substance abuse and misuse by teens and adults is a health concern in Jackson County. The health consequences of substance abuse can lead to poor health outcomes, including mortality, financial consequences, and crime. The two that we're going to look at for this is alcohol and marijuana, and focusing on 11th graders. So in Jackson County, 20.9% of 11th graders admitted that they had at least one alcoholic beverage in the past 30 days. And that's compared to 16.8% of 11th graders in Oregon as a whole identified that they had at least one alcoholic beverage in the past 30 days. So again, Jackson County is higher in this area than compared to the state. Marijuana is another issue in Jackson County, along with, because it is legal in Jackson County, but it's also very much a grow county, and so youth have access to marijuana, and it's very much a part of their culture. So 26.2% of 11th graders in Jackson County have used marijuana in the last 30 days. And again, this is compared to the state of Oregon. So 19.1% of 11th graders have used marijuana in the past 30 days. And as I mentioned around access to marijuana, we also know that 70% of 11th graders said it was very easy or sort of easy to get marijuana. So the easier it is to get a substance such as alcohol or marijuana or tobacco, the more likely that youth will use and engage in this risky behavior. Tobacco is another high priority in Jackson County. So Jackson County also has higher rates of adults that smoke tobacco or smoke cigarettes regularly, and this is compared to 19% of the state as a whole. There are numerous health consequences, again, from the use of tobacco. And so in 2014, there were 8,634 people in Jackson County that had a serious illness that was caused by tobacco. There were also 442 deaths that were related to tobacco, and $88.1 million were spent on tobacco-related medical care. This also goes along with that we had $70.6 million in productivity losses due to premature tobacco-related deaths. So tobacco use is very costly in Jackson County and also to our nation. Jackson County, we had 14% of mothers that smoked during pregnancy. This is higher than the state average with 11%, and then much higher than the state or the nation as well with 9%. One of the health consequences of mothers smoking during pregnancy is that they're more likely to have babies that are low birth weight, and 6% of the babies born in Jackson County are low birth weight infants. Another issue in Jackson County right now is sexually transmitted infections. And so quickly right now, sexually transmitted infections are really becoming a public health crisis in Jackson County, but that's much like the United States. And so our incidents of gonorrhea, syphilis, and chlamydia are all increasing in Jackson County, in particularly over the last year. So gonorrhea, our incidents, we've seen two major spikes in the past 5 years, and the first occurred in 2013. There was an incident rate increase of 384%, so we went from 15 cases per 100,000 population to 72.6 cases of gonorrhea per 1,000 population. And then regarding syphilis, we've seen very much the same increase as well. So looking from 2009 to 2012, our early syphilis rates were 0 to 0.05 cases per 100,000 population. And then in 2013, this jumped to 3.8 per 100,000 population. And then in 2016, we had an estimated early syphilis rate of 8.3 per 100,000 population. And as you can see with this graph, looking at Jackson County, our earliest syphilis rate, which includes primary, secondary, and early latent stages of syphilis, have since 2012 have steadily increased.